How to use the Rekovelle pen. Welcome to your guide on how to use the Rekovelle pen. Before you start, you should ensure you have carefully read the instruction manual, which you have received together with the Rekovelle pen. This video will guide you through each step of the injection process. You may pause the video at any time. If you have any questions about your treatment or medication, you should contact your doctor, nurse, or clinic. Before you start, make sure that you have gathered all the items you will need and that you have prepared a clean surface, such as a table or worktop. You'll need your Rekovelle pen, the instructions for use leaflet, a cartridge, a needle, and alcohol wipes. These are the parts of the Rekovelle pen. You may pause the video if you wish. Before using the Rekovelle pen, wash your hands with water and soap and dry them with a clean towel. Pull off the pen cap and disconnect the cartridge holder from the pen body by rotating and pulling away from the pen body. Verify that the dose window reads 0. If it does not, reset it to 0 by pressing the dose correction button at the end of the pen. Extend the lead screw by turning the gray collar until you feel it come to a stop. Do not try to rotate it further, as this could cause damage to the Rekovelle pen. Never extend the lead screw by pulling it out with your fingers. Never push the lead screw back into the pen, except as done when loading a cartridge. You are now ready to load your cartridge containing your medication into the Rekovelle pen. To do this, put the cartridge with the metal cap first into the clear cartridge holder. Place the end of the extended lead screw against the cartridge plunger, aligning the dot on the cartridge holder to the unlock symbol on the pen body. Push together firmly and rotate the cartridge holder. Make sure the dot is aligned with the symbol of the closed lock. It is important to visually check that there is no gap between the lead screw and the cartridge plunger before you proceed. Now you are ready to put the needle on. Peel the protective paper from a new pen needle and screw it firmly onto the cartridge holder. It is important to prime the Rekovelle pen once after loading a new cartridge to remove any air bubbles that may be inside the cartridge. Before priming the pen, you must remove the outer and the inner protective needle caps. To prime the pen, dial to the drop symbol on the dose selector. Point the needle upwards and tap the cartridge holder to move trapped air. With the needle still pointing upwards, push and hold the dose delivery slider towards the pen needle until the numbers return to 0 and a drip appears at the needle tip. A small amount of liquid should appear at the tip of the needle, and the numbers in the dose window should be back to 0. This means your Rekovelle pen is ready to use. If you do not see a small amount of liquid come out, all you need to do is repeat the priming steps until liquid appears at the tip of the needle. Make sure the dose window shows 0 and then turn the dose selector until you reach your prescribed dose. Each number equals 1 microgram, and each line between two numbers equals 0.33 microgram. Consult your healthcare professional if in doubt. You are now ready to give your injection. It is important to alternate the exact site of injection from day to day. Clean the injection site by wiping a small area of your abdomen with an alcohol wipe and let the area air dry. To inject, gently pinch the skin around the disinfected area between your thumb and index finger and insert the needle straight into the pinched up skin. Then, slide the dose delivery slider towards the needle and hold it in place until 0 appears in the dose window. Count 10 seconds before removing the needle from your skin. Not waiting 10 seconds may result in you not receiving your full dose. Do not interfere with the rotation of the dose selector during the injection. Doing so may result in an incomplete injection. After each injection, carefully replace the outer protective needle cap onto the needle and unscrew the needle. Discard the needle according to the instructions given by your healthcare provider. Please remember that the needle should not be disposed of in household waste. If the content of the cartridge is not enough, your pen will deliver the dose that is remaining in the cartridge and stop at a certain point. In this case, 0 will not appear in the dose window. After waiting 10 seconds, remove the needle from the skin and note down the number in the dose window. This is your remaining dose. All you need to do now is remove the needle and the cartridge. Reset the pen to 0 using the dose correction button. Make sure you extend the lead screw before you insert a new cartridge. Prime the Rekovelle pen as before. Select the missing dose and inject your remaining dose. Please remember that for the second injection, you should use a different injection site. The Rekovelle pen should be stored with the pen cap on and at or below 25 degrees Celsius. Never leave the needle on your pen during storage. To avoid potential damage, the dose window should read 0. For detailed information on storage, please refer to the patient leaflet. Please keep this video as you may wish to refer to it during your treatment. Please remember to keep the instruction for use leaflet, and should you have any further questions related to the Rekovelle pen or how to inject your medication, please refer to your specialist, doctor, or nurse.